Hi, everybody. Happy Monday and welcome to another Facial Pain Association webinar. I'm very excited about tonight's presentation. I'm going to introduce you to Dr. Jonathan Greenberg in just a minute, but I want to give you some quick announcements. I hope you've been enjoying this spring's webinar series that are based on our book, Facial Pain, a 21st Century Guide. The book itself is on sale on our website, and also the ebook for any of you who were unable to purchase that, that's now available basically on any platform that's out there. So you can get it on Amazon. I think you can get it on Barnes & Noble. I know for sure you can get it on Amazon. So if you're interested in the electronic version, the Kindle version, or any of that, those are all available on those platforms now, and you can still buy the hardcover version through our website. The past webinars are all on our website, and they're also on our YouTube channel. So either one of those, you can locate all past webinars. I guess I didn't have a lot of announcements to make. One more thing. Our new website is going to be launching this spring. We're really excited. We've been working really hard, and it's going to have a lot of new content, videos, videos from our conference, videos from some of these webinars, new resources, information, whole new look. So we're really excited about that. We'll send out information when the website launches. And without further ado, I'd like to introduce Dr. Jonathan Greenberg. He is a research staff psychologist with the Harvard Brain Integrative Health Clinic and Research Program. It's a mouthful. Dr. Greenberg, thank you so much for being with us today.
Absolutely. Thank you so much for having me, and thank you everyone for joining us today. So I'm going to talk a little bit about mindfulness today. I'm going to talk a little bit about how it can be used to cope with pain, and tell you a little bit about the general research about mindfulness. I'm going to start maybe by telling you a little bit about myself. So I grew up in Israel. I did my PhD in clinical psychology in Israel. I first got into mindfulness and meditation-based practices 18 years ago. I was just telling Allison that before. I was in New York. I picked up a book about meditation. I was curious, and then I went to India and I started to do my first meditation retreat. And that really got me kind of hooked. And starting in 2005, I started volunteering in a meditation organization. And so I ended up doing like 25 silent retreats. I was fortunate enough to be able to study mindfulness in my graduate studies when I was studying clinical psychology. So I did my thesis about the effects of mindfulness practice on cognitive ability and emotional regulation. In 2014, I moved to the States to do my postdoc. I joined the lab of Sarah Lazar at Massachusetts General Hospital and Harvard Medical School. And there I kind of really studied the effects of mindfulness on depression and on brain structure. So I started kind of to learn MRI. And then in 2018, I moved to the Integrated Brain Health Clinical and Research Program, where I am now, working with Dr. Anna Maria Franciano. And primarily, the main patient population I've been working with since then is individuals who face chronic pain. So we did a bunch of work with people with chronic pain, some of which I'm going to talk about today. I recently got a K-23 grant from NIH, and I'm also studying the effects of mindfulness practice on individuals with concussion and comorbid anxiety. So that was a long introduction about myself. So let's see what we're going today to talk about. I'm going to talk a little bit about what mindfulness is. I'll provide a kind of a brief introduction to it. I'm going to talk a little bit about how mind-body approaches, including mindfulness, can be used to target chronic pain. I'm going to tell you a little bit about the development of a novel mind-body program for facial pain, which you can contribute to as well, as I will speak about. I'm also very much hoping to include an experiential exercise so I can guide you through a brief meditation so we can get a little taste of what mindfulness is, even though it's going to be just very, very brief. And I'm going to end by offering some tips and strategies for coping with facial pain and how to integrate the practice into your daily lives. So what is mindfulness? So there are all sorts of definitions out there. They vary in different ways. So I'm gonna give you two definitions. One of them is the most widely cited definition, and one of them is the definition that I like a little bit more. So the most widely cited definition is by Jon Kabat-Zinn, and it is paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. Okay, so it's a certain quality of paying attention. We're paying attention in a certain way that is right now and in a non-judgmental manner. Another way of phrasing it, which basically aims at the same thing, but it's just kind of put a little bit differently, is the ability to know what's happening in your head at any given moment without getting carried away by it. I would actually replace in your head with anything else, because we can be mindful of what's happening in our head, but we can also be mindful of anything else that we do, as I will talk about soon. So both of these definitions, if you really boil it down, it comes down to two main components. Regulating your attention to something that's happening right now. It could be what you're thinking. It could be the sensations of your body. It could be your emotions. It could be any of your senses, what you're looking at, what you're listening to. As long as you regulate your attention to something that's happening right now, that's the first component. The second component is that of acceptance and non-judgment, right? So I know what is happening right now, and I approach it in a way that I'm willing to come in contact with it. I don't just kind of fight it or try to get away, try to chase it away or try to grab it and not let it go away. I know what's happening, and I try to be open and accepting towards it. That, in a nutshell, is what mindfulness is. Knowing what's happening now and trying to be kind of curious and open to it. That's pretty much it. There's a lot of blah, blah, blah around it, but that's the gist of it. So what is mindfulness not? There's a lot of kind of conceptions and misconceptions about mindfulness. Mindfulness is not having no thoughts in your head. So a lot of people start to meditate, or they try to meditate, and they're like, oh, you know what? I have all these thoughts running in my head. I didn't do it right. I wasn't mindful. That's not the case. Okay, you can be mindful of any thoughts that pop in your head and actually welcoming these thoughts and kind of approaching them and allowing them to be and run their course is a lot of what we do in mindfulness. Some people think that mindfulness is being not having any emotion. I'm okay with this. I'm okay with this. So, you know, I have a flat affective state, no emotion. That's not the case at all. Some people think that, you know, they imagine, oh, what is meditation? I have to be on the top of a mountain somewhere and sitting in a cross-legged position and doing That's not the case at all. Actually, we encourage the people that participate in our programs to integrate mindfulness into everything that they do, in their work that they do with their kids, mindful parenting, when they eat, when they shower. So it's the idea is to integrate it into your everyday life. And another two big ones is they think that's kind of chasing bliss or avoiding pain and stress. And that's a very big misconception, because people think, oh, if I just meditate, it'll take my stress and pain away. And it may have a bit of a kernel of truth, but it's not true, because a lot of the work that we do in mindfulness is become open and willing to come in contact with experience, regardless of whether it's positive or negative. So a lot of the work is working with states like pain or unpleasant emotions or difficult thoughts. And people think, hey, this is not supposed to be meditation. I came here to be nice and serene and calm, and people promised me it's going to be a stress relieving experience, but here I am, knee deep or neck deep, I would say, in negative experiences, and that's part of the experience. So it's not a quick fix, a quick way for me to get out of all unpleasant experiences, and it's not what it's designed to be. I just stuck this on here. It's just a very it's a very common cartoon lying around, like mindful, right? Are we kind of, is our mind full of everything, or are we mindful, right? Are we just attending whatever is in front of our eyes, attending the present moment? All right, if the sun and the trees are what's in front of me, which is the dog's experience, that is what mindfulness is. Some implementations of mindfulness. So mindfulness has really become a hot topic over the past, I would say, 2 decades probably. So it's implemented in schools today, it's implemented in healthcare settings, and in businesses, and in psychotherapy. There are all these mindfulness-based therapeutic programs being developed. The first one was mindfulness-based stress reduction. It was developed by John Kabat-Zinn, developed in the late 70s. And it started being implemented in the early 80s. The first application of it, interestingly, was in patients with chronic pain. So it was really designed for people with pain. So it's an 8-week program that really took some inspiration from Buddhist tradition, but it's secularized it. It has no religious affiliation whatsoever, and it's just an attention practice. So there are all sorts of spin-offs from this mindfulness-based stress reduction. There's mindfulness-based cognitive therapy, which was developed in the late 90s. It was specifically designed for people with recurrent depression. So people who have depressive relapse, and it was designed to prevent depressive relapse. It really integrates mindfulness aspects with cognitive therapy. And there are all these other therapies that are mindfulness informed, like dialectical behavioral therapy or acceptance and commitment therapy. These are all these different therapies that are informed by mindfulness, but not necessarily revolve around mindfulness. And there's a traditional mindfulness retreats that are called Vipassana retreats. I did a whole bunch of those. That's what you hear of those retreats, that you just stay silent for a week and you don't talk to anyone and just sit and meditate all day. It's not everybody has the availability to do it, but if you do, I would highly recommend it. I think it's quite the experience. So what do you do with these mindfulness programs? So they kind of vary, but they typically have certain practices in common. One of them is breathing meditation. Okay, so in mindfulness, what we do is we anchor our intention on something that's happening right now. And the breath is a very easy anchor. It's a very convenient thing to anchor our attention on for several reasons. It's always happening. We're always breathing. Every given moment that we're breathing, we can tune into it. And it's something that's happening right now. So it's an easy shortcut into the present moment, so to speak. Other aspects of breathing meditation, it's available, it's free, we do it all the time, it changes all the time. There's always a dynamic quality to it. There's air coming in, there's air coming out, it changes. And so it's interesting to do that, to really pay attention to something so that we're not really used to paying attention to. Another practice is the body scan. And that is where we kind of, rather than turning our attention towards the sensations of our breath, we turn our attention towards the sensation of our body. So we kind of scan our body. We just notice, okay, what sensations are happening in my head, and what's in my ears, and my forehead, and my nose, and I scan my neck, and I go down and up and down and up, and I try to just become aware of whatever our body presents. And what we find out a lot of the times is that whenever we're stressed, whenever we are anxious, our body is feeling it right away. And the body scan is especially interesting to work with among patients who experience some pain. And we're not going to do the body scan today, but I am hoping to get to some sort of pain meditation with you today. There's also an open awareness exercise in which you don't set a specific anchor. You just like think yourself, oh, right, I just attend whatever arises. Oh, now I hear a sound. Oh, now there's an itch in my knee. Oh, now I'm having the thought that I want to have lunch later. And just become open, and whatever arises, you just kind of let it go and pay attention to it. There's some mindful movement in a lot of these exercises. There are Q&A sessions, and there's daily homework, and practicing it daily is really something that is encouraged. And that is also something that I would encourage you to do, really giving it a chance and trying to integrate that into your day as much as possible. All right, so That was kind of what mindfulness is and a lot of its applications currently. So why would mindfulness benefit chronic pain? So there is this poem that is very frequently read in mindfulness retreats. It was written, I think, in the 13th century by a Sufi poet called Jalaluddin Rumi, and I will read it with you. Or unfortunately, because it's a one-way conversation currently, I hope to hear from you later on, but right now I'll read it to you. So let's read it together. All right, it's called The Guest House. It's one of my favorite poems, and I feel that it really embodies the mindful approach, even though it does not have the word mindfulness in it at all. So here we go. This being human is a guest house. Every morning, a new arrival, a joy, a depression, a meanness. Some momentary awareness comes as an unexpected visitor. Welcome and entertain them all, even if they are a crowd of sorrows who violently sweep your house, empty of its furniture. Still treat each guest honorably. He may be clearing you out for some new delight. The dark thought, the shame, the malice, meet them at the door, laughing, and invite them in. Be grateful for whatever comes, because each has been sent as a guide from beyond. So I like this analogy because it really exemplifies this ability to invite all experiences, regardless of what they are. We're kind of pre-programmed to welcome and grab onto pleasant experiences and to push experiences away that are unpleasant or painful. And so this approach is a bit different because regardless of pleasant or unpleasant, can we meet all our guests at the door, right? And that is particularly relevant when we're talking about painful experiences. Another conceptualization of why mindfulness may be beneficial for individuals with chronic pain is the fear avoidance model of chronic pain. So that is a very, very well-studied model. And it goes like this. So basically, let's see, I'm not sure if you can see my cursor here. Let's say there's an injury, or in the case of facial pain, a lot of times it's not injury, it's just chronic pain that develops. And then there's this pain experience. What happens to us usually when we experience pain? We begin to have certain thoughts. Very frequently, these are thoughts like, this pain will never go away. I'm going to be heavily disabled. I'm not going to be able to eat or to talk, or I'm going to be stuck with this for the rest of my life, right? And what happens when we have these thoughts, all right? That actually creates a fear of movement, of engaging in life, all right? Maybe we're scared to open our mouth. We see that with people with TMD a lot. But we start kind of limiting our life, right? So we don't want to move too much. We don't want to be too active. Maybe we'll limit our social circles and our social activity. And so we kind of become more and more avoidant. And so our world becomes narrower and narrower and narrower. And so what happens when we don't do as much and when we give up on things that are important to us, right? Physically, our body, our body gets deconditioned, so our muscles become weaker, and we may lose some of our physical capabilities. But it also has a pretty robust emotional effect in that we start to experience depression, or we start to experience stress, and we start to experience anxiety, and that actually feeds into our pain. And so there's this vicious circle, pain, more negative thoughts, more kind of fear of movement. And so there's more avoidance and more disability and more depression and more pain. And so the way out of this circle actually is through becoming more confrontative. So being able to confront all these experiences, even if they're negative, even if I have some anxiety, even if I have some pain, if I still can maintain being active and engagement in my life and still do the things that I care about, that is the way to recovery. And so through mindfulness, if we greet each of these guests at the door, even if they're an unwanted guest, right, that kind of wreaks havoc and kind of throws our sofa around and maybe breaks the flower vase or whatnot, if we're able to be with that experience rather than have it take over us and kind of in an overwhelming manner, that is key to recovery. A little bit more about the mindfulness approach to pain. So I'm not sure how many of you are familiar with this, but this is a Chinese finger trap. And in some of our interventions and programs, we actually hand these out to participants because I find it to be a great metaphor to the mindful approach. So what a Chinese finger trap is you kind of insert your two fingers just like in picture. And the immediate response of people is to try to pull away. Actually, I wish I had one here. I don't have one here. But the trick is the harder you pull away, the tighter the grip is. And so people become a bit panicky. It's like, oh my God, I can't take this out. And they're trying to pull harder and harder and harder. And the grip becomes harder and harder and harder. So what is the way out of this Chinese finger trap? Counterintuitively, it's actually moving towards, right? Moving toward the trap, having these two fingers actually be together. And if you decrease your avoidance, if you actually take an approach stance, if you move towards the pain, then it loosens up and creates, a potential to kind of become free from it. Not that it's gonna make your pain go away, but it does give you some degrees of freedom. And there's less tension sometimes if you kind of go towards it. Also, awareness and curiosity of negative experience. So a lot of the times we feel that we're drowning. We're in a lot of pain, we're in a lot of stress, maybe we have depression, right? And so we feel that we're drowning. But through mindfulness, if you just kind of hold it in an open way and you kind of gather the courage to stare the tiger in the eye and say, okay, let's see what you got. I'm here, you're here, pain, maybe I can invite you, but instead of being my enemy and just having to fight you all the time, maybe I can invite you to a little cup of coffee, right? Maybe I can change the way, maybe I can be with you in a way that is less fighting your enemy. And that can change our approach to pain, because a lot of the pain that we experience is not only pain. It's all of our resistance to the pain and all of our anguish due to our pain. And so there's a lot of layers of suffering there. And also, mindfulness can allow us to have a more accurate perception of our pain. Just because we are kind of wired not to spend too much time with our pain and we don't want to look at our pain, we kind of keep it as this kind of monster in the cellar and we kind of lock the cellar up and we don't want to look at it. And so sometimes we get the feeling or kind of the impression that this pain is always horrible and it's always very intense and it's always with us. But if we become mindful of the pain, we're willing to come in contact with it. So we're kind of putting on an investigator hat. It's like, okay, let me try to be curious about this. Let me see what this pain is. Is it warm? Is it hot? Is it cold? Is it prickly? Is it tingly? And then you come in contact with it and you notice that it actually changes with time. It's a whole dynamic process. There's a whole world of sensations. Not all of them are necessarily negative. Pain is negative, but there's a lot of things going on in there that are not only negative if you kind of pay attention to it. And when people become mindful of their pain, they also notice that it changes over time. It's not as constant as we once thought. And so if we train ourselves to be more mindful of our pain and mindful in general, we see that it's not as a block of constant misery that doesn't change as we might imagine it to be. So I deliberated how much science should I actually, so I have some meta-analysis and reviews about mindfulness for pain. I'm gonna give you the bottom line here. The bottom line is that there is some evidence that mindfulness decreases pain. So there is some evidence for that. Effect sizes are kind of small, sometimes they're medium effect size. So there is some evidence that mindfulness reduces pain. But what is most of the evidence actually points that the big benefit of mindfulness is in living with the pain and in the increased quality of life, increased well-being, decreases in anxiety, decreases in stress, decreases in depression. So I might have some benefits with regard to the pain, but most of the benefits are in living a better life, even though I have pain. It's not a magic button that's going to take your pain away. It's not. In our interventions, we do see significant decreases in pain, but it's not what we primarily target. What we primarily target is leading the best life that you can, even if pain is there. There's a nice saying that I like that you may or may not have heard of. Pain is inevitable. Suffering is optional. So as humans, we experience pain. In Buddhism, it's the first noble truth out of the four noble truths. It's the first noble truth. Pain is there in each and every individual, right? There's no way we can completely avoid pain in our life. But it's interesting to hear that suffering is optional. And between the line here lies a presumption that there can be pain without suffering. So there can be pain there in the background, but we can still prosper and grow and do the things that are important to us in our lives. And a lot of what we do in our interventions is aimed exactly at that. Alrighty, so let's talk a little bit about an intervention that we have for chronic pain that we call it Get Active. It's a mind-body intervention for chronic pain. I won't talk too much about that. I'll just tell you a little bit about the components of it. So basically, it was a 10-week intervention. So we recruited individuals who had chronic pain, and we taught them a whole bunch of skills. So mindfulness skills, some deep breathing, doing the body scan when you go over your bodily sensations, a whole lot of coping skills. So we teach things like adaptive thinking, which is basically, when you become aware of your thoughts, and sometimes your thoughts can, they're not really accurate. Maybe you're catastrophizing, or maybe, it's all or nothing thinking, stuff like that. We teach gratitude and empathy, laughter and acceptance. We also teach some physical activity skills, as well as education about pain. So we set specific goals. We learn to pace ourselves so that we can increase our activity over time in a safe manner. And we learn about this disability spiral, in which, the less we do, the more deconditioned we are. And so we have more negative emotions and more disability, as I talked about a bit earlier. I'll spare you all the graphs. I removed all the graphs from my presentation. I'll just give you the bottom line, and you'll have to take my word for it that they were, we have like 10 papers out of this. I don't remember how many. So there were some improvements in physical function and pain intensity and pain catastrophizing. People were less afraid to move. People had more adaptive coping. They were higher on mindfulness. They had better emotional function, which means less depression and less anxiety. They were even higher on social isolation. We didn't really directly target social isolation, but it was a group experience. And so the group cohesion that we had, it looks like it had some beneficial experience for our participants. We also had a version of this intervention for chronic pain that was specifically for individuals with chronic refractory temporomandibular joint disorder, so TMDs. And we also had some pretty good results here. We had reduction in pain frequency, reduction in pain intensity, better ability to endure symptoms, improvement in all sorts of measures of mental physical functioning, and also an objective physical functioning like range of motion of the jaw and muscle function, and stuff like that. So part of what we want to do now is really take this intervention that we have really good preliminary data for and tailor it specifically for individuals with various types of orofacial pain. So not only TMD. And a lot of you that are facing orofacial pain, I am sure that many of you are struggling with stress or maybe loss of work, and there are not many effective treatment out there for you. So a lot of what we're trying to do, our mission is to try to help you and develop a program that you can do from the comfort of your own home. But for that, we kind of need your help. So what I'm going to ask you to do, if you have the time and availability, is take 20 minutes of your time. And Allison, can we kind of post that link to our survey?
Yep, I'm going to do that. And then I can also send a follow-up to all the attendees. Plus, they're going to get it in an email on Thursday. So
awesome. So, so Allison is going to post in the chat a link. I'm going to ask you to click on that link. It'll take you to a website. Save that for after the talk. If after this talk you can spare 20 minutes just to fill out some questionnaires, that would be of enormous benefit because we need your voices heard. We need this preliminary data so that we can get this program funded, and we will tailor and adapt this intervention, particularly for your needs. And we need to know what are the things that are more challenging for you, and we need to have some correlations for our measures so that we can choose the most appropriate intervention targets. And so if you want to help other patients with facial pain have an intervention that is really tailored to their needs, I really ask that you copy this, click on that link, spend 20 minutes answering these questionnaires, and that would be of huge help for us and hopefully for other patients at the Facial Pain Association, because we really take this collaboration seriously and we really want to provide you with the best intervention possible that would really target what you need. But we need to know what you need, and that is why I'm going to ask you to just fill out that survey. 20 minutes for your time will be much appreciated. Alrighty, so maybe we can try some experiential exercise. I was deliberating what kind of exercise to do. I know we don't have a lot of time, and I don't want this to be too long. So what I'm going to do is we're going to start with some mindfulness of the breath. And I'm going to do a very light version of mindfulness of pain because it can be, to jump right to mindfulness of pain can be a bit intimidating. I am going to encourage you, if you, at one point, I will direct you towards your pain. If you find that it's too severe or too intense or overwhelming, just continue to do the breathing meditation. You are in control here. If you don't like it, don't do it. You can always resort back to focusing on your breath or do something else altogether. But it is something that we heard over and over more from our participants in our programs, that it is something that can be helpful because there lies the potential to change our relationship with pain from an enemy that we have to fight at all costs to it's kind of like a roommate that we live with in our lives, particularly if you have chronic orofacial pain. It's just something that's just there a lot of the time. And if you kind of change your relationship to it and make it less of an enemy and be more open to it, it can reduce a lot of the suffering that is often associated with this type of pain. So let's do it. So let's kind of get comfy in your chair. If you want to close your eyes, I would kind of recommend closing your eyes. If you just want to soften your gaze, you could do that. I would recommend that if you're I know how webinars go, and then probably 65% of you are kind of checking your emails and doing other stuff. So if you were to tune in, I would recommend that now would be the time. And I would recommend that you give this a chance. because it's very different just kind of hearing it in the background and actually doing it yourself. So give it a chance. Just going to be for a few minutes. Another heads up, your mind is going to wander very, very frequently. And it's not a sign that you're not doing it right. Right? It's called, in Buddhism, it's called the monkey mind. Our mind kind of goes from branch to branch, going all over the place. And you're going to hear me guiding you through this meditation. And very quickly, you're going to start thinking about what you have to do tomorrow and what you have to do tonight and what that person said to you at work yesterday. And that's fine. Whenever you catch yourself doing that, just return to your breath. The practice is not measured by how much of the time you're distracted. It's measured by time and time again, we bring our attention back. So let's do it. So let's close our eyes and just kind of become comfortable in our chair. We can maybe start by taking just a few deep breaths. Just inhale and exhale fully. And just do that maybe 2 or 3 times. Just see if you can gently relax into whatever your current experience may be. You can maybe pay gentle attention to the posture of your body. You don't have to change your posture, just notice it. Noticing the contact of our body with the chair, maybe the contact of our feet with the floor. Just gently noticing if there are any points of tension in our body. And not doing anything about them, just kind of resting into them. Invite them to let go just a little bit, if possible. Maybe we can gently pay attention to our breath. So that can be the sensation of our abdomen rising and falling. It could be over at our nostrils, feeling the air come in and go out. We don't have to change our breath in any way. We allow it to do what it wants in its own natural pace, natural rhythm. And whenever our mind wanders, as I'm sure it has, just gently bring your awareness back to your breath and try to be curious about it. This process, it keeps us alive and sustains us each and every day. Is our breath long or short? Is there a difference in the temperature of the air when it comes in compared to when it goes out? Can we just relax into our breath? Allow it to be just as it is, right here, right now. And gently turning to our body, let's choose one part of our body that is not in pain right now. One part that is not experiencing pain. And just see if we can notice any sensations there. Can we notice our clothes over that part of the body? Can we notice our skin? Is it dry? Is it moist? Is it itchy? Is it anything at all? Invite any sensation to arise. And notice if it changes from moment to moment. And now, very gently, if we do experience any pain and discomfort right now, can we gently bring our mindful attention towards our pain? Can we open up to it just a little bit? Again, if it's overwhelming, if it's too intense, you can just go back to your breath. But if it is possible, can we just notice this thing, pain? What is it? Let's kind of investigate. Is it a prickly sensation? Is it a hot sensation? What are the boundaries of it? Can we just let it be as it is right now? Does it change from moment to moment? Maybe it moves around. Maybe the quality of it changes. Whatever it is, just let it be. And then maybe turning our attention back to our breath. Taking maybe 2 or 3 deeper breaths before we gently turn our attention back to the room and opening our eyes whenever we're ready to do so. So, typically would have a bit of a discussion, and I'm curious to know what your experiences were. I'm sure some of your experiences were, I was completely spacing out. Some of your experiences were, oh, it was horrendous. Some of your experiences were, you know what, I was able to be with my pain and still be okay. I'm sure you have a diversity of experiences. And I'm happy to hear about it later in the question and answer sessions if you do have any questions about that. For now, I will move forward and talk a little bit about some tips and strategies for optimizing coping with chronic facial pain. The first part is trying to incorporate mindfulness into your daily life. So I would encourage you to give it a shot. That little 3-minute exercise, I don't want you to feel that, oh, now I fully know what mindfulness is. It's, it takes some practice to really be able to apply it in your daily life. And I would encourage you to apply it both in a formal way, so we have formal practice and informal practice. So the formal practice, you know what? You just sit and you meditate for 5 minutes or for 10 minutes. Just sit and just focus on your breath, or you can focus on the sensations in your body. Whenever your mind wanders, you bring it back. I would also encourage you to bring that quality of openness, of attention and curiosity and non-judgmentalness to your day-to-day lives. So if you're listening to somebody, can you really pay attention and be open to what they're saying? You can be mindful when you brush your teeth, when you take a shower. Eating is a wonderful opportunity for mindfulness. I very frequently work with the patients that I see on mindful eating, just because eating is something that we do. It's something that can be very much enjoyable, but so much of our lives, we just kind of scarf down the food while we're kind of on our emails. We don't even taste the food. We don't even recognize that we're eating it. Oh, our plate is empty. Where did it go? Right? But if you really kind of place something in your mouth and you really just let it dissolve in your mouth and you really close your eyes and you pay attention to all the processes that are going around in your mouth, it really, it can help you make wiser nutritional decisions and help you enjoy your food more. You can also do what we call minis. I know you guys are busy, a lot of you work and you don't have a lot of time, or you're parents, or you're studying. You're very busy. You finish something, can you take 5 breaths? Just take 5 breaths, do a brief check-in with your body, and then move on. There's a reason why big corporations like Google and IBM and a bunch of others, they really encourage their employees to do mindfulness, and they have like mindfulness teachers, just because it can increase your productivity, it can decrease your stress, it can kind of reset you a little bit, and you can move forward in a more concentrated way. Read mindfulness books. I'm going to show you I'm going to offer you some examples of mindfulness books that I recommend. You can watch mindfulness related talks and videos. If you just go to YouTube and you put mindfulness there, or you put John Kabat-Zinn there, or if you can do a course, that's the best thing. If you can do an intervention, a course, a retreat, I can offer you I will post some resources and websites that you can take advantage of. Try to notice automatic reactions to pain and stress. So a lot of what we teach our patients is the first step in changing a behavior is noticing your reaction to it. Okay, so just notice we're so used to, when something happens, boom, we just react, right? But can we just be with it first? And if we develop the capacity to be with it, then we can actually make a choice rather than having our reaction dictate to us by some habit. That creates a space for us to react in a different way that may be more helpful for us. Try to develop curiosity and openness even towards unpleasant experiences, like we tried to do today a little bit. Cultivate gratitude every day. That's a big one. So if I always tell the people in our programs that if there were a school for happiness, happiness 101, one of the main things that they would teach there is developing gratitude. So yes, we have chronic pain, and it's not easy, and it affects our lives in a lot of crappy ways. And it's very easy for that to take over and for that to be everything that we see. But there is a lot of good in our lives still. Okay, we have maybe relationships. We have the capabilities that our body still has, even though it may have chronic pain. And we have to actively train our mind to become sensitive and aware so we can kind of soak up all the benefit and the goodiness of all the good things that we have in our lives. So I would highly encourage you to just have a gratitude log, maybe on your phone or on a piece of paper, on a notebook. Just jot down something that you're grateful for every day. It doesn't have to be something big. It has to be, I had a really good lunch today. I had a conversation with my daughter today, and it was really pleasant. My dad got vaccinated, and I'm able to give him a hug. Something every day, and that could really change even the effect of pain on our lives, even though it's not directly a pain exercise. And finally, cultivate compassion towards yourself. So we all have the best of intentions to be what we want to be and have things our way, but a lot of times it doesn't work that way, right? And a lot of times we slip into our old habits, or maybe we lash out at people, or whatever it is it may be. Can we develop this kindness towards ourselves and really have some compassion towards ourselves? Yes, you know what? We're facing a lot of tough crap, right? Can we cut ourselves some slack? Can we be more gentle with ourselves? Concluding remarks. Mindfulness involves paying attention in an open and curious way. It can help cope with chronic pain. Cultivating daily mindfulness practice is helpful. And finally, you can help the development of a novel mindfulness and meditation-based program specifically for individuals with chronic pain. I will, again, go to that chat, click on that link after the talk, do the 20-minute survey. We hope that it's really going to help out on making your voices heard and helping other patients who have chronic orofacial pain. These are some resources and apps. This is a very, very brief version. I have a longer version of like websites and stuff like that. I'm going to send that to Allison, and hopefully you can have that on your website. By the end of the month, I'm going to write a little blurb with some more resources. If you want to start with mindfulness reading, I would recommend Full Catastrophe Living. It's one of the best-selling books by Jon Kabat-Zinn. There are also some pain-specific books, The Mindfulness Solution to Pain, or You Are Not Your Pain. And there's so many mindfulness resources out there. You can also try apps like Headspace and Calm, Stop, Breathe, and Think. Even on Netflix, I think they have this show now. They have a Headspace program on Netflix. So if you have Netflix, give it a shot. Just search for Headspace. They have some cool exercises there. I'd like to thank my team, especially the director of our program and my mentor, Dr. Anna Maria Vinciano. That's her, and that's kind of the rest of our team. And I'd like to thank you for listening. And again, we need you. We need to hear your voices. So if you can do that survey, that'll be great. So that kind of concludes the talk part, and I'm happy to answer any questions.
That was fantastic. I've got several questions, some of which you've answered, so I'll just kind of sort through these. So somebody, hang on. She said, what do you suggest is a good first step or first thought when you first get that, flash of pain, to accept her pain. She said, especially when she's in a full flare up, it's so hard that her instinct and her head are just screaming, no, stop. So what do you suggest is a good first thought when that fight or flight instinct is kicking in and you can't think of anything except the pain and taking, can't even think about taking a deep breath?
Yeah. So what I would suggest is the more you practice it when the pain is not a 10, when it's not at full intensity, it's a skill that you develop. And so when you practice it, when your pain is a 0 or a 3 or a 4, it'll naturally kick in when it's higher. Now, sometimes the pain is too high to open up to. Like we don't like if it's it's more than I can handle right now. So then do whatever works for you. If it's a distraction or some I don't know, washing the face with cold water, watching TV, anything that can like take your mind off the pain if it's too much to bear. So we're now only learning these skills, and so we kind of learn to open ourselves up to it when the pain is kind of small. So I would practice with the pain when it's small. When the pain is boom, when it's a tidal wave, just if you can take some deep breaths, if you can just like, and when you exhale, physically relax your entire body. You can do it lying down. Just lie down on the bed. Take a deep breath, and when you exhale, just relax all the muscles of your body. You can even do some, you can imagine the pain kind of going away from your body with each relaxed out breath. And again, it's not a magic cure. It's not going to instantly take your pain away. But the more you practice it, the more embedded in your life it would become, and you can work your way up to having relief even from relatively intense pain.
Are there any, you gave some great resources for books and online things. As somebody asked me specifically, does your group have classes? And someone else asked, are there any retreats? So when the world is all repaired and we can get back to being together again, do you have any in-person retreats, or do you guys offer any programs, or can you recommend any, particular kind of retreats anywhere?
Yeah, so I will. So as part of the blurb that I'm going to send, there's going to be a whole list of resources, and that includes meditation centers. In our group, we are a clinical research group, so we offer research studies. And so part of what we're hoping to do is develop this intervention for orofacial pain, which we really hope when it gets funded that you guys are going to be able to participate. But until that happens, there's a Cambridge Meditation Center, there's a, oh, sorry, I'm thinking Boston. Yeah, there are plenty of resources, because you're not in Massachusetts. But there are plenty of resources all over, and there are also kind of websites that you can take online courses, and you can read more about mindfulness. And so a lot of what we do is live video, so you can participate even if you're not in the Massachusetts area. And I will post a link not only to our research center and our program, so you can review all the studies that we have, but to kind of like national places that offer such retreats and such courses. And again, a good place to start would be like picking up a book, and you'll see other kind of resources and places that you can take courses, both in person. I hope that they're back to in person right now. I'm not positive that that's the case, but online, surely, I'm sure of that.
Awesome. Yeah, somebody commented that it was powerful when guided as opposed to try to do it on her own. And I always feel like that too. That even if I'm listening to like on a podcast, having that guided part definitely adds to it and makes it, I don't know, it just feels like it works better in some way. And somebody else said that was the best 3 minutes of her day, and thank you.
Yeah, well, I'm glad you were able to give it a try.
Okay, so let's see. Someone said that her pain is currently covered pretty well by medication. She did notice that during the mindfulness exercise that she still carries a lot of tension in her jaw. Her question is, in past studies, have patients found they can reduce medication when they're using mindfulness practice?
Yeah. So in some of our studies, we did see reasonable effect sizes for reduction in pain. We didn't really statistically analyze the reduction in medication, so we didn't kind of quantify that in a way that we can say, hey, it's statistically significant. But we did have a lot of people report that they use less medication for various reasons. And one reason for that is, you know what, they may experience less pain, but another reason for that is if you develop a greater capacity to be with your pain and still be okay, then you would less need to, take that medication to kind of suppress it. Because even if you are in pain, you can still work through it, you can still engage in things that you like, and you can still kind of be with it rather than constantly just fight against it.
This is a great question. She says, sometimes reactions to pain seem almost involuntary. I mean, I think on the surface, that's what you think. This is physical pain. I have no control over this. It's interesting when you talked about the emotions that are on top of it, because I think we all realize that. But in the moment when you're feeling pain, you're like, this is just pain. Pain is pain. But anyway, so she says, sometimes reactions to pain seem almost involuntary. Can you talk about how to become aware of the moment before that first negative reaction to the pain?
Mm-hmm.
I guess that's like the where your brain goes, oh crud, I'm in pain, or here comes the pain, or my pain is just being triggered. Oh crud. Yeah. And then you go down that.
Yeah. And so absolutely, it's fascinating to experience, and that's why I would encourage you to kind of to have this mindfulness of pain in your daily life, because basically you're a living laboratory. And it's interesting to see if we put our investigator hat on. So you notice, you're meditating, and then there's a shooting pain in your jaw. And then you notice what's happening. Oh, I'm sweating now. And then my mind's like, oh no, here it goes again. It's going to get stuck. I'm not going to be able to close my jaw. It's never going to go away. And then your emotion, you get this constriction in your chest, and maybe your heart starts beating a bit faster, and you start getting all sweaty, and that actually amplifies your pain. And there's a whole domino reaction that encapsulates your behaviors, your thoughts, your emotions, and your physical sensations. And I would encourage you to explore that while you're in pain, and just see how it affects your body. And the more you're able to see that chain of events, oh, first there was a shooting pain in my jaw, then I had this thought, and then I had this emotion, and then it created this sensation. Really having this domino effect outline right in front of your eyes, then that creates maybe a tiny window through which you can change it. Because yes, the initial shoot of pain, maybe you're not able to change that. But you know what? If you were going to meet your daughter that day, or go out for a walk, and you know what? Maybe you could still do that even though you have the pain. So again, if we put our hand on a hot stove, if you're the shooting pain, you're going to take your pain away. And it's actually a good thing for you to do that if there's actual harm being done. But a lot of the trouble that we face when we're having pain is in the aftermath. Yes, there was a shooting pain, the shooting pain went away, but you know what? I still have this tension. I still have this anxiety. I still have this fear. I still have this depression. I still have this fear of movement, which actually exacerbates my disability. And these are the things that we can actually have control of and work with.
And when you talk about the noticing pain and something you just did now, you kind of put the words to it, which I just found to be helpful, is you're saying, okay, and now the pain feels like that. Now I feel this. It's almost like you're kind of narrating to yourself. If you were like the narrator of what's happening to this character in this movie or book, now this person is feeling a warm sensation. Now that feeling is spreading. Like you were talked about the pain. Does it move? Is it moving? Is it changing? Because I was wondering what you kind of say to the pain, in a way, like, are you, but you're talking about it in a way, you're kind of narrating it. And so I guess is this wrong that by doing that, you're just kind of objectively not analyzing it, but you're just kind of stating the facts, ma'am, like, just these are the facts of,
yeah.
you're really doing when you're opening yourself up to the pain while you're being, doing this practice?
Absolutely. And I think by kind of, sometimes we call it labeling. You just label, oh, now it's a prickling sensation, or now I'm having a thought of this. You just kind of label your experiences. It it puts you here in the experience over there. So just doing that creates some space between you and the actual experience. And that within itself can be very helpful. Because if I'm here and I'm noticing it, so that's over there and I'm over here, so I'm not my pain. There is just pain here, and it kind of changes over time. And that can actually create some space. So it's not me. I'm kind of separating that as just, we have several metaphors for that. Sometimes we, as clouds in the sky, imagining that, it's, oh, now this, and it's passing away, or kind of leaves on the stream is another metaphor that we use. Here's this experience. Oh, now I have this pain. All right, now it's going away. And then there's another leaf, and then there's another leaf. And so you're just kind of, you're taking an open, curious observer stance rather than you being your pain, you're kind of on it.
Somebody said it reminds her of Lamaze training for childbirth, and someone else talked about putting it in the background, which is something that I've learned to do with my tinnitus. And that's how I think of it, is I put it in the background. So
yeah.
These are all kind of different ways of thinking about it, but
yeah, absolutely. And it can be there. It can be there in the background. And you know what? If it amps up, you don't have to kind of suppress it. You can let it have its say. Sometimes I give the example of, like, there's like an open mic night and your pain really wants to speak. All right, give it the mic. All right, pain, what do you have to say? This is really horrible and you're never going to get better and I'm going to make your life miserable. Okay, pain, thanks. Does anybody else want to come in for the open mic now? Okay, we can keep on doing what we're doing. I have to work now. Thank you, pain, for having your say. I'm going to write my email now. So we allow it to have its say, but we're just not overwhelmed and having it dictate our lives to us.
Yeah, it's like you said, this isn't going to, really reduce pain in a major way. Hopefully reduce it in some way, but it's really about the increasing of everyone's quality of life and allowing you to, I wrote down what you said because I thought it was great, decreasing anxiety and depression around it, and just living a better life, even though I have pain. As my friend Antonecki would say, this is just another tool in the toolbox. But I think it's like the, it's a good multi-purpose tool. I think it's a good one. So thank you so much, Dr. Greenberg. We hope everyone out there, please click the link, take the survey. That's really going to help. We're very excited about this partnership. Working with Dr. Greenberg and his team, and hopefully developing some, protocols for people with orofacial pain. And so we're going to send you all of the resources that we talked about. Please remember that the Facial Pain Association is a registered 501c3 nonprofit organization, and we really do rely upon your support. So please consider making a donation to the FPA and helping us continue these programs. And I hope, oh, you're welcome, Amy. Thank you a million times over. And I hope you guys all have a great week and happy first full week of spring. And Jonathan, we'll talk to you soon.
Absolutely. Thank you so much for having me.
Awesome. Thanks so much. Good night, everybody.